thank the Robert Wood Johnson Foundation and the Donahue Foundation for their generous support of this conference. Our center, the Center for Health Incentives and Behavioral Economics, I just wanted to highlight a couple things. Our mission is really to conduct basic applied behavioral economic research to improve health, healthcare delivery, health policy. We really have three main goals. One is to advance the science, the knowledge, the application of behavioral economic interventions, to train the next generation of leaders in the field, and to engage private and public sector partners to develop and test scalable, cost-effective applications. We have three affiliated centers: the Center for Healthcare Innovation at Penn, which is run by David Ash, the Penn Roybal P30 Center on Behavioral Economics and Health, which has been a joint center with Carnegie Mellon, which George Lowenstein is the co-PI of, and the University of Pennsylvania CDC Prevention Research Center, which is a new entity which is jointly led by Karen Glantz and myself. So what we're hoping to do over the next couple of days is really just have an interesting discussion about some of the areas people are currently working on and some of the areas people hope to work on. And without any further ado, let me introduce Deborah Bay from the Robert Wood Johnson Foundation, who's going to greet you from the Foundation's perspective.
Several years ago, we started hearing more and more about the power of behavioral economics to guide better decision-making. At the time, it was mostly being used in the financial and business sectors, and we wondered how it could be applied to health. Today, thanks to many of you and the work you're doing, we see the myriad of ways that behavioral economics can be applied in health, from redesigning hospital cafeterias to getting physicians to decrease the number of low-value healthcare services they provide. We're starting to build the evidence base for what works and, just importantly, what doesn't. We're moving beyond testing novel approaches to exploring how we create change that is sustained over the long term. And I believe we're at a pivotal time with this work. Behavioral economists are seeing more opportunities in health and healthcare. Experiments and pilots are gaining traction. And people who are steeped in population health are paying attention to see how behavioral economics can be part of the solution. If we understand how principles like choice architecture, defaults, incentives, and rewards can be better applied in health, we can make it easier for individuals to take steps to improve their health and ultimately make the healthy choice the easy choice.